Hey everybody, this is Munson Steed with Health IQ. So when we're at RIDE, we really work to have subject matter experts who are in front of the thought leadership. One such person is the dearest doctor who has served our country, served our community, and really has a perspective that we need to listen to and understand to eliminate the myths and make health a priority for our entire community. I'm very proud to introduce you to a distinguished surgeon, distinguished doctor, a member of our community, Dr. Matthews.
Thank you, Monson, for inviting me back again.
Well, it's I don't know that we can keep saying it, Doc. I am very, 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 and I don't know if I said it enough, concerned that our health is not our number one priority coming out of COVID as a community.
No, it's not.
I'm sorry.
I said, no, it's not.
Yeah. And it was my biggest concern for the Black community that in all that we experienced, it's still not a priority. And there have been gracious servants like you who we can trust. So now you don't have this hesitancy. The person isn't invested in the community. It's some white person telling you something. No, these are members of our community in the healthcare profession who've taken their oath and are doing outreach to eliminate the distance, which is why we do Health IQ, obviously part of your service, but they are literally still not making it. Why should health be the number one priority for the Black community?
Well, there's a saying in medicine, health before wealth. If you're unhealthy as an individual, as a state or a nation, it costs more. It costs more money to be sick. Well, people can work. They don't miss work. They don't take up a lot of healthcare dollars. So actually your economy, your country, and everything runs better when people are healthy and well. Like you see now, we're spending a lot of money on coronavirus and getting little results from it. We have right now almost 500,000 people, 500,000 people dead, and more, deaths are predicted. So it's affected the economy. People lost jobs during this time. There are still people laid off. People are unable to pay their rent. So when you have an unhealthy economy or unhealthy world, it affects the whole world in terms of the economic growth and just everything. Mental health is bad. There are more suicides now. A lot of people are not doing well mentally. There's more domestic violence going on. So it affects everything, every quality, every aspect of life.
So for our community, doubling down, we know now, I hope everybody heard that, we're doubling down literally on the impact of health in the economy, which you just explained, but the Black community. We've seen this health disparity during COVID, and we could actually do something about it if we made health number one. What should we be doing and why health, Black community priority, and how?
Well, I mean, I believe in health for everybody because you can't single out one group because like I like to use an analogy, if you have a patient with infectious staph disease, they get on an airplane, they're going to infect everybody. So it's not going to be limited by any boundaries or whether it's race, creed, sex, or whatever. A bad disease, coronavirus doesn't know anybody, regardless of which part of the world you're from, country. If you don't have a healthy system, it will kill you or make you ill. And so we need to get the whole world healthy. And this is what we need to do, a global health program.
So it seems that for our community, knowledge of health or self advocacy or being able to advocate, because when you and I appreciate you coming because you share insightfulness that I apply to my life because I trust you. And so I don't want the community to think that we're just randomly talking. It's a real concern. Mm-hmm. How do you recommend we advocate for ourselves when we are at least in the health system?
Well, you have to take an active role. You have to take an active or progressive role and not a passive role. So I have a lot of patients when they come in and you're explaining things to them, then you ask them to explain back what you just said. And they cannot explain back what you said, or they can't even repeat it. But they don't want to ask questions because they don't want to look like they're not intelligent. And they'll sit there and just nod their heads. So you have to break things down as a physician to like they do in a newspaper. Newspapers are written on an 8th grade level. They don't write a newspaper or a magazine on a 12th grade or a college level because you missed the majority of the people. So doctors have to be taught and learn that they need to discuss everything on that 8th grade level. And if you have somebody that's at a higher intelligence level and they want to go to that level, you can do that. But with the average person, you have to explain it and break it down, because I'm not a lawyer, I'm pretty smart, but if a lawyer starts sitting there talking about lawyer terms, I'm not going to understand. So that does not mean I'm not intelligent. It just means I don't understand that jargon. So we have a lot of itises and ology in medicine. So unless you've been to medical school or you're medically trained, you're not going to understand a lot of that stuff. So it's our job to break it down.
So a lot of information being pushed out by non-medical authorities. Where should we really be getting our medical information from?
Well, I trained at Mayo Clinic. Mayo Clinic is the #1 ranked healthcare system in the world. And so I was there 5 years. They are trustworthy. They're very knowledgeable. Some of the smartest people I met in healthcare at Mayo Clinic. So you can go at mayoclinic.com healthcare site. So they give good, conservative, concise information, and they're not going to mislead you. They're not going to tell you anything wrong. So that's the first place I recommend people go, is to the Mayo Clinic healthcare site. Just Google Mayo Clinic health.com or Mayo Clinic healthcare questions, and it'll pop up information for you.
And so when they're out there, just following up on that same question, should people be literally watching videos about their health on YouTube?
It depends. If you have somebody knowledgeable in that field, I would, look at a video. If you got a Mayo Clinic doctor doing a video on something, they're going to tell you straightforward information, or you have an expert in that field or somebody that's medically trained, they're usually going to give you expert opinion. And so I would stick with the medical professions. And so if I wanted to, if I have a heart condition, I wouldn't want to talk to an OBGYN that delivers babies. That doesn't mean they don't understand the heart. It's just not their area of specialty. So I usually recommend people stick with the specialist in that particular area, and you won't get misled, or you won't get confused with all this additional information out there.
We're not certain what our daily regimen of vitamins, better natural hormones that we should be placing into our body based on the fact that Black people literally can't get enough sunlight. Can you share your approach and your theory that obviously you've proven to the FDA on why vitamin D is so important for us to increase as a Black community?
Well, it's a hormone, first of all, so it's not a vitamin. So like I said, a hormone is an anti-stress hormone. So anytime your body is stressed, you'll need more vitamin D than when you're not stressed. So when you're stressed in a stressful situation, whether it's a pregnancy, coronavirus, heart attack, stroke, or you're in a car crash, you have a traumatic brain injury, you shot, or a concussion, or pneumonia, or whatever, you go in the hospital, your vitamin D level is going to drop 50% within 24 hours of having that injury, because your body's trying to heal itself. So when you're trying to heal yourself, your body's going to rush blood to the injured area. It's going to rush nutrients to that area. So your body needs more nutrients and more vitamin D at that particular point, or hormone D. So hormone D does a lot of different things. It controls 3,000 out of 30,000 genes in your body. So among those are your immune system, or how well your immune system works. So it helps your T cells, which are white blood cells, get mobilized and heal infection or whatever. It does cancer surveillance. So it is quite adaptable. So vitamin D or hormone D revs up your immune system for any type of stress that you're undergoing.
Well, let's talk about stress. For those who don't really have an idea, where is our bodies during COVID given that we are all at home, stressed each day with relatives, death, the very country in a pandemic, both racially and economically. What's our stress level, Doc?
Our stress levels are through the roof. You actually have to bring the mental health aspect into that too. So you have to manage the mental health because we live in a stressful time. Our way of life has been totally altered or changed. You know, we're social creatures. We're used to communicating with people, being aware. So now your loved one goes in the hospital with coronavirus. You can't even be there for them. You're not there and they die. You just get a phone call. Only 10 people can go to most funerals, so you don't get closure. So that's not regular for us. So it's worldwide. It's a change for everybody. So we're all stressed. So you have to acknowledge that everybody is stressed, and you have to acknowledge that I need to deal with my stress. Seek mental health care professionals to help you with your psychiatrist, psychologist. Talk to a family member, or there are ministerial counselors that have been trained to counsel people or help people. So seek out somebody that's going to give you some comfortable, good, logical, professional advice. That's what I would recommend. And so not going to YouTube and just listening to somebody that's just talking about it. Make sure they're reputable and certified and they have adequate training. And then ask around. People, the word of mouth is goes a long way. In the hospitals, nurses are usually good resources. They know most of the doctors, and they can usually tell you who's who and who. Or you could just ask, who would you go to? Is a safe question. Now, who would you recommend? The better question is, who would you take your loved one to? So that is a key indication, and usually you can't go wrong if you stay within those parameters.
So when you think about that, increasing your vitamin D helps our entire community deal with
Yes.
the stress that we're going through COVID. So if you would share with them how you began to approach this methodology of higher levels of vitamin D and then actually prove it that there was a need.
Okay, first of all, what we did was to prove it, we just started taking vitamin D levels on all our trauma patients. So we know what the normal vitamin D level is, what the government says, and then yeah, I've read over 1,000 articles before I even started my research. So I'm an avid reader, and I looked at every aspect of it, and so we quantified, where everybody's levels were, and we noticed we did look at the African American females, African American males, Caucasian males, Caucasian females. And then we looked at the whole group collectively, and then we broke it down based on ages. And so we looked at it upside down. We turned it all the way around. Like, do younger people have lower levels than older people? Do older people have lower vitamin D levels than older people? Do women have lower levels than men? Do people of color have lower vitamin D levels than lighter skinned people? So we looked at that, and what we noticed was African American females had at the lowest level at 9.8 nanograms per milliliter. Federal government says 30 is normal. However, you still have body processes that are not satisfied at 30. 30 is just enough to keep you from getting rickets or soft bones. So you get maximum bone density when your vitamin D level is 40 nanograms per milliliter. So actually, my first paper, I challenged the federal government's level of 30. I said, how can 30 be normal nanograms per milliliter, which is a simple blood draw? How can that be normal if you don't have the strongest bones at that point? Your bones don't get strongest till you get to be 40. So 30 cannot be a normal level if you still got a physiologic process is not satisfied. You get maximum muscle contraction at 40 nanograms per milliliter. So that is important in athletes and old people, is that they don't get stronger muscles until they get to a certain point. So you cannot be healthy at 30. So a person at 30, a professional athlete, he's going to have more muscle pulls, more muscle tears, more muscle strains, and he's going to get fatigued earlier in the third quarter. He's not going to be able to do as much work, or his body's not going to be able to use as much oxygen. So also at 40 nanograms per milliliter, as the vitamin D level goes up, you have another hormone called your parathyroid. So parathyroid is located in your neck on each side. So these as the vitamin D level goes up, parathyroid hormone level goes down. They're totally opposite. So you don't get like the most suppression of your parathyroid hormones till your vitamin D level is 40. So it's too many things going on at 40 nanograms per milliliter. So 30 can't be normal if you got all these physiologic processes. So what the body is telling you at 30 nanograms per milliliter, I'm not going to bind. I don't have enough vitamin D in my body to bind my muscles and bones to make them the strongest and contract the most. So I need to get a higher level to order to make that work. And so then there are other processes that are not satisfied at 30 or 40 nanograms per milliliter. So you have to understand the body and how it works, and then how much gas you need. It's just like saying you can put a quarter of a tank and go from Atlanta to California on a quarter of a tank of gas. It's not going to happen. So you may be able to make it to halfway to Birmingham, but you're not going to make it to California on a half a tank of gas or a fourth a tank of gas. So your body is like that. So you have a vitamin D level of 30, your bones are not going to be the maximum density. So that's important in elderly people or elderly women that has osteoporosis.
So for our community, they imagine the Black community that, and thank you for that, because I think Black women should know, like these are the things, the elderly, anybody taking care of a family member, check the vitamin D level, and then know that we need to be higher than is recommended.
Yes.
For some people, the question is, does that have an effect on my liver or my kidney if I increase my vitamin D hormone?
Well, we looked at that too. So a lot of the patients that we took care of, trauma patients, about a third of our patients were homeless or, living in low income areas and stuff. And we had patients that are drug addicts or substance abusers and bad livers, bad kidneys, HIV. So almost every disease on the planet, we've seen it, so we had to take care of pregnant women, and we supplemented them with vitamin D. So it actually works on everybody. And then what you can do is we watch the calcium level. So when the calcium levels start rising, there's a certain point where we know to stop the vitamin D if your calcium level gets too high. So as you supplement the vitamin D, your calcium level may go up a little bit. So reach a certain point, we know to cut it off or stop it there.
But it has no effect on your kidney.
All kidney patients have low vitamin D levels because you need the kidney and the liver in order to make vitamin D from the sun. So the body makes vitamin D. 90% of your vitamin D comes from the sun striking the skin, and it takes cholesterol to make a compound that goes to the liver first, and it gets a chemical group added on at the liver. Then it goes in your bloodstream to the kidney, and the kidney adds on another chemical group to activate this hormone D. So you need healthy skin, you need adequate sunlight, you need a healthy liver and a healthy kidney in order to make sun. So you need multiple different things. So as you age, a person over the age 70 can only make 25% of a 21-year-old because their skin is not as active as a 21-year-old person is. So a 70-year-old person can only make 25%. That's why their vitamin D levels are lower. And dark-skinned people have to stay in the sun 3 to 10 times longer to make the same amount of vitamin D as a lighter-skinned person. So it's affected by your skin color, your age. Obese people store vitamin D in their fat cells. It's not in the blood. You want the vitamin D in the blood system. So an obese person, they actually need a higher vitamin D level. A tall 7-foot person would need more than a 5'1" person. And so you have to understand all these different variables. Then you have to look at the medications that they're on also. If you're on seizure medication, steroids medication, HIV medication, all these lower your vitamin D levels. If you have any malabsorption syndrome like Crohn's disease, ulcerative colitis, spruce disease, or any of these other diseases, that lowers your vitamin D level because your body's not absorbing it much. People that have radiation to their colons and stomachs and all that, and people that have had gastric bypass surgery have lower vitamin D levels. So there are about 28 or 30 different conditions that affect your vitamin D levels. So you need to know all those 30 different conditions and how they affect and how they interact. And you need to know if the person's stressed or not. So you kind of need to know, it's almost like knowing chemistry and calculus at the same time. So I've been doing it so long, I can just do it naturally and just in the top of my head. So that's the problem, is that's why I tell people, don't just go buy vitamin D and take it. You need to do it in concert with your doctor, because there are so many different variables that affect what your vitamin D level is.
So for those who aren't getting ready to go to the doctor, what would be an acceptable level of IU, just if they wanted to increase it, to kind of know that they're at least feeding or going in that direction? Is there an amount?
Well, I don't like to give out amounts because, like I said, people always do opposites of what you tell them to do. And even my own family members, if I tell them to take one, they'll call me up and say, well, I've been taking 4 or taking 5. So I like to monitor and know where they are. So I don't just give out random numbers on, doing interviews and talks. Try to encourage them to get with their doctor. They may have a condition that affect their vitamin D level. Some people can take a certain amount and it doesn't raise their level. Some people can take a certain amount and raise the level too high. So everybody's different. So there's no one size fit all. There's no one size shoe fit everybody.
So I think you came back to the same point.
Mm-hmm.
You definitely need to go annually and make a check or biannually to know where your vitamin D level is.
Correct. That is very correct. Because if you gave 2 people the exact same dosage, one person's level might eventually become normal. Another person's level might stay low or even go down. They may be on medications that have a certain condition. And remember, this is a hormone. This is not a sugar pill. And so there are some side effects with vitamin D. There's vitamin D toxicity. So that's why it needs to be monitored by a doctor. So this is just not some harmless candy that you go to the store and buy and take. This is a hormone. It's the most important hormone in your body because it controls 10% of your DNA. So that's very important. You want that monitored and be in discussion with a healthcare professional or provider about your vitamin D level.
So even in that, Dr. Matthews, you have a position where once our community understands their vitamin D level, they need to monitor it for their entire life. Because
yes, you do. From crib to cradle is what I call it. So from the time you're conceived, you need vitamin D to the time you take your last breath, lifelong.
So in those individuals who are watching and they assume because they're Black, they're getting more vitamin D. Is that true?
No, that's the opposite is true. Remember, like I said earlier, we have melanin in our skin, and melanin is a pigment in our skin, and it actually helps you when you're on the equator. So melanin works just like sunscreen. It protects you from getting sunburn and skin cancers. So a dark-skinned person like you and I would have to stay in the sun 3 to 10 times longer than an average, a lighter-skinned person or person with less melanin to make the same amount of vitamin D. So if you and I went outside and stayed outside, we would have to stay in the sun 3 to 10 times longer than a lighter skinned person because they can make it faster because basically melanin blocks up to 98% of vitamin D production. So that's why our levels tend to run 30% lower. So in that study that we did initially, we found that all Blacks were basically running 30% lower than the average Caucasian. And so that's where we found most of our healthcare disparities to be. There's always talk about it's socioeconomics, is this, is that. Socioeconomics does play a factor. It plays it rounds about 18% of healthcare disparities. But we found out most of these healthcare disparities were due to vitamin D deficiency. And once we got the vitamin D levels normal, all our patients, complications, heart attacks, strokes, length of stay, hospital cost, falling out of bed sores, all sepsis, all that stuff decreased. Urinary tract infections to the same rate. So we got our mortality rate, overall trauma mortality rate down from 11.4% down to 4.1%. So everybody was dying at the same rate. The only patients we had down on our trauma service, which is the busiest, and you have the sickest patients. So you got gunshot wounds and brain injuries and people impaled on objects and people thrown out the car at 80 miles an hour, parachutists falling out the sky. So the only people that were dying were people that had brain herniation or that they were just so bad that it was just nothing left to fix. And so if you came in and some patients, if you had a pulse or you had no pulse and it was less than 5 minutes, we had a high probability of saving your life.
So you're Black, you need to know that you are definitely 30% lower automatically just because.
Typically, that's on the average. That's not everybody. Lifeguards or people that work outdoors had adequate vitamin D levels. Policemen that used to walk the beat had average vitamin D levels. And actually, I was surprised to find out, this sort of shocked me, the football coaches, the head coaches, and usually had higher vitamin D levels than the younger football players. Because most football coaches in the summertime, they got short pants on, they have a hat on, they got short sleeve shirts. The players got helmets on, they got pads on, they got a big jersey on, they got long pants on, so they're covered for the most part. So the coaches who were older actually had higher vitamin D levels than most of their players. They were 18 and 19, and that was shocking.
Now you say the equator. Vitamin D clearly plays a role as it relates to access to the sun. So literally timing, we should
Yes,
all
timing.
know during their kind of seasons that you're going to get less automatically. Can you share with us those seasons and what we need to do to understand that we're not getting enough vitamin D even during these periods?
Yes, I was looking on Facebook, and a young lady from my hometown actually made a statement. She's visiting in Florida. So she made a statement, I'm down here getting a lot of vitamin D in Florida. This was this week. And so I I texted her on Facebook or Facebooked her and said, young lady, you aren't making any vitamin D because you're in the Northern Hemisphere at this time. So we can only make vitamin D in the Northern Hemisphere from late March until early October. So from October to the next March, you make zero vitamin D, even if you stand outside 8 hours a day. Because remember, I said you need the sun at a 90-degree angle. So the sun is below the equator, is in the southern hemisphere. And so it doesn't come back to the northern hemisphere until what, March 21st, when we switch back over to spring. So right now, you can stand outside all day, you're gonna make zero vitamin D because the sun is below the equator and it's at a 45-degree angle. So the earth rotates, that's what creates the seasons on its axis, 23 degrees, creating spring, summer, winter, and fall. So we can only make vitamin D in the northern hemisphere in the spring and the summer. And so in the southern hemisphere, their seasons are reversed. They can make it in the our winter and fall. And then when the sun comes back to the northern hemisphere, they can't make it, during the next 6 months or so. So it's based on the rotation or the angle of the sun. So you need sun. We're just like plants. Plants you can only grow crops in what? Spring, and you plant in the spring and then they come up in the summer, you harvest in the fall. So if you went outside and planted any type seed down in the United States, you're not going to grow anything. So we're like plants. They produce fruit, in the summer or in the fall, in the winter, summer, and in the spring, and we produce vitamin D during those times. So you store it up for the winter. That's why you get the winter blues, because it drops in the winter, and people get more colds. They're more depressed during that time. So when spring come out and get out in the sun, they begin to feel better. They got more energy. The attitude usually brighten up. That's where seasonal affective disorders come from, is that in the wintertime, your levels drop. So vitamin D affects your brain, your mood, your focus. People that are vitamin D deficient often have brain fog, they're moody, they're anxious. So it affects your mood, it calms you down.
So even when we're in winter, we need to be aware that we're not getting it.
Yes.
We need to understand that melanin defends us from sun cancer, but it also deflects any vitamin D, even though in the winter we wouldn't get it anyhow.
Yeah, it keeps you from making it. Mm-hmm.
Right. So the melanin keeps us from making it.
Mm-hmm.
And I mean, Doc, that's a whole lot to think about.
Yeah, that's why I said it's complicated. It's chemistry, it's biochemistry. And one of the hardest courses in medical school is biochemistry. Most doctors, they're very smart, brilliant people, but a lot of them struggle with biochemistry. Yeah, because you're looking at things from a chemical level, whereas gross anatomy, you're looking at things like this is a blood vessel, this is an artery, this is a nerve. Then you got all these formulas to deal with, you got math to deal with. So biochemistry is a little bit of everything. It's a little bit of calculus and statistics and math and vitamin distributions. And so you have to take a lot of things in considerations and stuff. So when I was a chemistry major in college, I used to get the computer paper and sit down and write down all the formulas and write all this stuff out. And so then I did it over and over. I would be up all night doing this stuff. So until it became like a reflex or became automatic and natural to me. Most people didn't do that. So they have a limited understanding of biochemistry. So your body is a big chemical factory. So you got to understand how this chemical interacts with that chemical, what this does, what this doesn't do. And then you have to understand what medications affect them. When you add in the different pharmaceutical medications, how does that affect your body? How does that affect the natural chemistry? So chemistry is complicated. It's fun. I love it. I like it a lot. I'm good at it, but it's complicated. So you have to figure out all these different variables. And that's why a lot of doctors don't understand vitamin D. They don't understand these different variables that we're talking about now.
So, for a family who really lives in a cold climate, works indoors,
Mhm.
our transition of being an agricultural community to now being an urban indoor working community, how is that affecting our vitamin D levels and just the ability to acquire vitamin D?
Well, let me give you a perfect analogy for that. That's a good question, Monson. I remember when we were little kids, we used to ride bicycles. We did not wear shoulder pads, helmets, and knee pads. And you scarred your knee up, you just like washed it off, got on your bike. We used to climb trees and fall out of trees, and you just dust yourself off and got back up. It's very seldom a kid fractured or injured themselves or got head injuries or had to go to emergency room when we were kids. So I can almost count the fractures in my friends. We were very active and aggressive, and we used to play tackle football in the streets. You didn't get kids didn't get that many concussions as they did now because 50 years ago we had higher vitamin D levels because we played outdoors. And men usually hunted, they fished, the women had to hang clothes on the clothesline before the advent of washers and dryers. The little girls were outside playing hopscotch, jump rope, and stuff like that. So all your activities were done outside and all summer long when you were out. So we had higher vitamin D levels. So then when we switched to a technology society, computers, everybody's indoors and sunscreen. So the advent of those two things, people's vitamin D level dropped. So if you go back and look from the 1960s, 70s, you would notice there's a steep increase in the amount of just concussions that they have in football. And so even though we have better equipment now, you're still seeing more concussions because we have lower vitamin D levels. And it's basically due to our lifestyle have changed. So we're not outdoor people. So back in the old days, so 800 international units that the federal government says is how much vitamin D you need. That's probably what you needed back in the agricultural society because you're outdoors all day. Then in Mississippi, our summer jobs, there weren't any summer jobs. So you had to chop cotton or do that. That was your summer job. So you're in the sun from sun up to sundown 6 days a week. That was a 6 day a week job. So our vitamin D levels were through the roof. So we didn't get colds and get ear infections like these kids. Now, I don't think I had, one ear infection my whole life growing up. And then back in those days, Mississippi, they didn't have insurance through the teachers' jobs. So you had to pay cash when you went to the doctor. So you were going to get doctored at home, and they were going to keep you pretty healthy. We ate fresh foods. We grew our own garden, and it was organic. We didn't put even fertilizer on it. We just chopped the gardens and kept the grass out with hose. So we ate a lot of fresher foods, and had all the additives, the food colorants, and the preservatives that we have in food. So all those things make a difference. So we were outdoors more, so the kids were actually active, and you had less obesity back in those days too, because everybody, in order to make the football team or the cheerleader team, the girls would be out there running just like the football players were in June and July, so they could make the cheerleader team. They knew they had to keep their weight or their BMI, body mass index, down to certain levels. So now things have changed, and so people are not as active as they were then. I remember we had to walk to school. So my junior high school was a mile away, so we walked to school with books and a whole mile, and so that was every day. And so we were getting exercise in. We played sports when we got through walking that mile, and you ran track and played football. So we were a lot more active back in the old days than what we are now.
I thank you for that. But you mentioned something, food choices.
Mhm.
What do we need to know about even food as it relates to vitamin D?
Okay. Well, you only get 10% of your vitamin D from your foods. Most foods have zero vitamin D in it. Only foods that you can get vitamin D, milk has 100 international units in it, but you need 800. So you'd have to drink too much milk. Most people have lactose intolerance, and they don't have the enzyme to break the milk down. So milk makes them sick, it makes them nauseated, it bloats them, diarrhea. So probably 70% of African Americans don't drink milk, can't drink milk because of lactose intolerance. So the only other foods that really have a decent amount of vitamin D are the fatty fish, the mackerel, the salmon, the tuna, that most of our people don't eat. And then some rare forms of mushrooms. But Even eating those foods, salmon only has about 400 international units in it. So you would have to eat a whole lot of food to get the amount of vitamin D because 90% of it comes from the sun striking your skin or from being outdoors, but only during a particular time of the year, then a particular time of the day. So during those summer and spring months that you can make vitamin D, you can only make vitamin to 3 p.m. So in the summertime, if you go outside after you get off work 4 p.m., you're just gonna get darker and get some sunburn maybe, but you're not making any vitamin D after 3 p.m. So it's seasonal specific and it's time specific also.
So for all of us who are watching, what we should know is one, get our vitamin D monitored so that we have a real idea of where we are. Two, the role of vitamin D and how key it is as being a hormone that affects our DNA. I'm not sure people know and need to hear on how does a hormone affect DNA and what does that mean?
Okay, you have genetic material. Your DNA is like the blueprint. It's like a house. If you're building a house, the contractor needs a blueprint on how many rooms to build. Is a one level house, a two level house, a three level house. How deep he needs to dig tells him depending on how many levels of the house is. So the taller the house, the deeper he needs to dig in the ground to get the foundation. A single level house does not need a deeper foundation as a three level house. So he has to dig deeper in the ground for that foundation. So that's the blueprint, your DNA. So think about your DNA as a contractor looking at a blueprint. Blueprint tells you how to build a house, what type of house, what type of material to use, and how big the house, how many square feet it's going to be. So your DNA tells you how tall you're going to be, basically, or how much weight you're going to be, what color your eyes going to be. So that's the blueprint for you. Your IQ and all that, to a certain degree. But a lot of these things are affected by environmental factors also. So think of DNA as your blueprint. Okay, think of RNA, which is your DNA gets copied into RNA, and RNA, think of that as a person that's reading the blueprint or he's a contractor. So RNA makes proteins. Proteins are things made by your cells that determine, and then it makes your muscles and your skin and hair and nails are all protein. So with this genetic material, what vitamin D or hormone D does is it goes into the cell and tells these cells like, look, okay, we're stressed. I need you to make more white blood cells. So the DNA has a blueprint on how to make the white blood cells. So the vitamin D just tell them, look, you're the blueprint. I need more white blood cells to fight off this coronavirus infection. So this basically, it can signal the genes that are already there on what to do, but the blueprint is in the genes. And so it's the signaler. So think about vitamin D or hormone D as a signal that tells the blueprint what to do or how much you need or how much to make at that particular time.
Well, thank you. I really wanted our community to understand how essential it is for vitamin hormone D. Maybe I want to follow your lead. We need to begin to say hormone D.
Well, I still call it vitamin D because it's been around 100 years. And so all in the last 20 years have we really learned it's a hormone.
By learning that it's a hormone, what did we learn?
We learned, we have radioimmunoassay and all these different tests now that they can, test things on a microscopic level or very low level. So when they inject dye into people and they looked at the vitamin D, and then they found out that it joins to every cells, your brain cells, your breast cell, your colon cells, your bone cells. They originally thought it was just for strong bones. Then they noticed, this stuff lights up on every cell and tissue in your body. So this is not just for bones, this is for your brain, your heart, your lungs, your kidneys, your colon, your hair, everything. So once we learn there's a hormone, then it goes in your blood system, and it affects everything in your body. So vitamin D actually helps your heart, so it makes, what it does is absorb calcium. Calcium basically makes your muscles contract, your skeletal muscles. And calcium also makes your heart muscle contract. So your heart muscle is a muscle also. So being vitamin D deficient affects your heart just like it does your bone. So we learned all the different things that it does. Then every cell in your body needs phosphorus to make ATP, which is a natural fuel. So if you have low phosphorus, you're going to be fatigued and not have enough energy. So this thing affects everything in your body, every system in your body. So we learned the different things that it does over the last 20 years. And it's like, hey, this is not a normal substance.
Well, you heard it here first, everybody. I always enjoy when I talk to Dr. Matthews. I glean, but I want to know, particularly at RIDE and obviously on Health IQ, that we give our community a vision of themselves. And I want to share the vision of someone like yourself who's been dedicated to healing. This isn't a person who hasn't. He sees the disparity, he's addressing it, but literally informing what we can actually do to affect this. Anything else you want to say about vitamin D, hormone D for our community right now?
Just spread the information. You can go on, you can Google my name, Dr. Leslie Ray Matthews. You'll pull up a lot of additional information on Google. You can go to my Facebook page, is where I probably put the most concentrated information. You can go back as far as 3 years ago. I talk about vitamin D and, even address some of my patients on there, how they overcame things that were considered just scientifically impossible just by supplementing with vitamin D. So my Facebook page is Leslie Ray Matthews, and I have an Instagram page also, Dr. Leslie Ray Matthews. So those are three ways you can do additional research or find out more about vitamin D or hormone D.
Super. Well, everybody, this is Health IQ. I've been with the wonderful guest, Dr. Leslie Ray Matthews, who is a true healer in our community, dedicated to the success and the health success of our community. This is more from Munson Steed and Health